All right, let's talk about enalapril. It's a cornerstone medication that millions, and I mean millions of people rely on to protect their heart and get their blood pressure under control. It's just a tiny pill, but it has a massive impact. So let's get right into it.
And that really brings us to the big question, right? How in the world does one tiny little pill manage to regulate something as complex and as vital as your body's entire pressure system? Well, the answer is actually surprisingly clever.
To really get how the solution works, we have to understand the problem first. Your body has this brilliant built-in system for managing blood pressure. It's called the renin-angiotensin-aldosterone system, or RAS for short. But sometimes this system just goes into overdrive. It goes rogue, and that's when you have a system out of balance.
At the very heart of this out-of-control system is one specific molecule. Let's think of it as the villain of our story, angiotensin-2. Its main job? It's the body's master constrictor. It tightens things up and cranks up the pressure.
So when you have too much angiotensin-2 floating around, it launches this triple threat. First, it literally squeezes your blood vessels, and that makes your pressure just skyrocket. Second, it sends a signal to your kidneys to hang on to extra salt and water, which increases the amount of fluid your heart has to pump. And third, it actually promotes unhealthy changes and growth in the heart itself. Not good.
So, with this villain running rampant, how do you fight back? Well, let's meet our ally, our hero, Enalapril. And it's a truly ingenious solution, but it works in a really clever way, almost like it's in disguise. Okay, and this is the disguise I'm talking about. Enalapril is what's known as a pro-drug. What that means is, when you actually swallow the pill, it's inactive. It's not doing anything yet. It's only after your liver gets a hold of it and processes it that it transforms into its active, super powerful form, which is called enalaprilat. This is a really crucial piece of its design. So how does this newly activated hero actually disarm the villain? Well, here's the clever part. It doesn't fight angiotensin-2 directly. Nope. Instead, it goes after the factory that makes it and just shuts the whole thing down. It blocks the production line. So think of it like this. Your body starts with this inactive material, angiotensin I. Then, a really important enzyme called ACE, that's the Angiotensin-Converting Enzyme, comes along and works on it. And that conversion process is what creates our powerful villain, angiotensin-2. It's a simple, but in this case a really problematic three-step process. So, where does our hero come in? This is the genius part. Enalaprilat steps right into the middle of that process, and it directly targets and blocks that critical enzyme, ACE. It basically jams the machinery. And by doing that, it stops the conversion of angiotensin-1. The result? The production of that harmful angiotensin-2 is just slashed. No enzyme, no villain. It's really that elegant. And the payoff here is like night and day. Without enalapril, you've got tight blood vessels, you're holding on to fluid, and your heart and kidneys are under constant strain. But with enalapril on the job, blocking the villain's production line, your blood vessels can finally relax, your body lets go of that excess salt and water, and your heart and kidneys are protected from all that pressure.
Okay, so with this incredibly powerful mechanism, enalapril gets sent on a few key missions. Let's take a look at the specific conditions that it's designed to treat.
Its number one mission, of course, is hypertension, high blood pressure. But it's also a foundational, absolutely critical therapy for heart failure because it helps a weakened heart pump more easily. It's even used to prevent heart failure from developing in some patients. And so importantly, it's used to protect the kidneys from damage caused by diabetes. It really is a multi-mission protector for that whole cardiorenal system.
But look, like any powerful tool, enalapril comes with a user manual. And understanding these rules of engagement is absolutely crucial for using it safely and getting the best results. So when it comes to potential side effects, you can kind of put them in two buckets. In the common bucket, you might get some dizziness, maybe a headache, especially as your body gets used to the lower blood pressure. But the most famous one is a dry, hacking, persistent cough. Then you have the serious, but thankfully rare, bucket. This includes something called angioedema, a rapid swelling of the face and throat that is a medical emergency, and high potassium levels, which is exactly why you need regular blood tests. Yeah, let's zoom in on that cough for a second. It's so well known because it's caused by the exact same mechanism that helps lower your blood pressure. And while it's not dangerous, it can be really, really annoying. And as you can see here, it's often the number one reason a doctor might switch a patient to a different class of medication. Okay, and now we need to talk about this single most important warning of all. This is a black box warning, which is the FDA's strongest possible caution.
Enalapril must not be used during pregnancy. It is absolutely contraindicated. It can cause serious, devastating harm or even death to a developing fetus, so effective birth control is a must if you're taking it.
And there are a few other groups who need to be really careful. Obviously, anyone who's ever had that swelling reaction, angioedema, needs to be cautious. Same for people with specific types of kidney artery problems. And you have to watch out for interactions with really common drugs like ibuprofen or with certain diuretics, which can cause problems.
So if you're taking this, what does it all boil down to? Well, it's a pretty straightforward checklist. First, take it exactly as directed. Good news is, you can take it with or without food. Second, keep an eye on your blood pressure at home. Third, make sure you stay well hydrated. Fourth, and this is huge, report any side effects, especially any swelling or that nagging cough, to your doctor right away. And finally, just expect to get those periodic blood tests. They're there to keep you safe.
So, to wrap it all up, Enalapril is so much more than just a blood pressure pill. It's a cleverly designed prodrug that literally transforms inside your body to become a guardian for your heart and kidneys. And it does all of that by masterfully blocking one single critical enzyme. And that just leaves you with a pretty fascinating thought, doesn't it? The story of Enalapril really shows how targeting one precise point in a biological chain reaction can have these profound life-saving effects. It really makes you wonder, what other master switches are hiding inside our own bodies, just waiting for the right key to be discovered?